Hello, everyone. Thank you so much for joining us today for the continuation of our series, Oh Baby, Household Safety and Poison Prevention. This week, we are covering the ages of 11 to 14. If you're interested in any of the previous age categories, they're up on our Facebook Live. For now, we'll go ahead and dive in. Once again, my name is Amanda Hammond. I'm the Clinical Toxicology Fellow here at the Georgia Poison Center. I am a PharmD and a Master of Public Health, and I'm so excited to get to share this information with you guys this morning. What are our objectives today? Similar to previous presentations, we want to describe the poisoning risks specific for this age group. So today we're looking at sort of that middle school age group, 11 to 14 years old. We want to discuss the most common ingestions, again, specific to this group. And then we're going to review how we can best limit those risks and when to call the Poison Center. As well, there will be a question and answer session at the end, just in case there's anyone watching live who has a question or concern. As always, we will start with what are the actual risks to my child? So, looking at poisoning risks for children who are 11 to 14 years of age, we see kind of three main categories of risk. First is the fact that there are appropriate transitions of independence happening. Second, we're going to look at how children in this age group identify with medications. And then we're going to look at changes in responsibility and independence kind of outside the home. Looking a little more deeply into each of these categories, transitions of independence kind of breaks down into a few specific things. So, first and foremost, we see independent personal care. So, in this age group, we really see children start to take autonomy for their own personal care. Things like showering, washing their hair, brushing their teeth every night, getting dressed on their own, and really kind of solidifying that independence of taking care of their own needs when they can, and that leads to more alone time as well as more unsupervised time potentially in bathroom spaces like where medications are held. Another thing is they learn to start articulating their own needs so they can self-identify a headache and understand that medication might treat that, or they might identify other health related needs. The last thing kind of that falls into this category is the understanding of self. So it's around this age that we see children start to identify or categorize as someone with health related problems. So they're more likely to kind of categorize themselves as someone with allergies or someone with ADHD. And again, kind of then relating that self categorization with a need for, and a potentially appropriate need for medication, but, a need for medication. Now, looking at how children identify medication, this is how they relate to and understand medication, as well as kind of things in their environment and their potential benefits versus risks. So, actually, a little bit younger than this age group, it's around age 6 that it's shown that children begin to be able to understand medications, identify them by their names, and associate medications with their reasons for use. So when we actually, again, look even slightly younger than this age group, probably around 6 to 8 years old, we see children. There was a survey that asked children about the names of medications that they would take for if they had a cold, and even kindergartners were able to name different products by brand names in addition to vitamins. But by 10 and 11 years old, really coming into this age group that we're talking about today, it's when children's vocabulary about medication reaches really an adult level. And so the communication that you have with them and that they have with others can really increase in complexity. When we look at this category, we see kind of three main subcategories, which is fear of medication. So, is medication common in your home? Do they understand dangers? Do they see the mechanism of medication as magic? Or do they see the mechanism of medication as kind of more scientific? And the way that they either fear or understand medication can affect how likely they are to use it unsupervised. Again, kind of beliefs about how medication works. So, a big disconnect here in this age group is often the common misconception that more medication is going to lead to a better, bigger effect. So, children don't necessarily understand maybe that medication comes in milligrams. So, even a small amount of milligrams could come in a lot of capsules versus a large amount of milligrams could come in one capsule. They don't really necessarily understand that difference. So they think maybe more capsules or more of the liquid will make their headache go away faster, and that can create some potential risk. And then lastly, understanding of a normal medication related concepts. So whether or not a child understands that medications can have side effects, right? So we know that our cough and cold medications can help us feel better when we have a cough or cold, but do they understand that there are possible negative outcomes for medication, that it's twofold? The last kind of category of risk is our responsibility and independence. So this just has to do with, again, normal transitions of independence. And this can be things that are also outside of the home. So children in this age group have more unsupervised time, both inside and outside the home, which creates opportunity for curiosity or exploration or accident. They have chores and obligations, such as watching younger siblings. This could potentially lead to risk for either of the sibling involved when there isn't an adult supervisor. And then also, this is really the age that we're starting to see children become very, very involved with social media challenges and peer pressure, and the mental health effects associated with social media use do kind of increase our risk that a child is going to potentially use medication. So now we want to kind of transition into what are the most common ingestions for this age group? What are the things that, per our Georgia Poison Center statistics, they get into most often? The three categories that we're going to briefly discuss today are analgesics, antihistamines, and antidepressants. Starting with analgesics, we can see that this is kind of a pain relief category, and there can be analgesics that are over the counter, ones that you can just buy at the grocery store or buy at the pharmacy and take home with you, such as our acetaminophen or aspirin or our topical salicylates like Icy Hot or Bengay, ibuprofen or naproxen. And then there's also prescription medications like our opioids or anti-migraine medications, or some of our over-the-counter products, but in an increased strength or concentration. Studies show that essentially, at this age, children are engaging in two specific kinds of risks. So they're having hobbies like being outside, camping, hiking, they're participating in sports. And those things can generally just lead to injury if you trip and fall or if you get hurt playing a game. And children are more likely to start trying to self medicate. They realize, oh, I tripped and I twist my ankle and it hurts. Mom uses ibuprofen when she has a hurt ankle, so I'm going to take some. Another thing that we see in this age group is the development of psychosocial stress or academic stress, or if there's an unpredictable environment at home. So children who are lacking stability or attention due to various constraints on time from the adults in their community. Essentially, this kind of diverse stress can present as pain. And again, at this age group is where children are more likely to attempt to self treat that manifestation of pain with medication that is in the home. Moving on to our next, common exposure, these are antihistamines. So things like Benadryl, Claritin, Zyrtec. They range from mild to potentially very dangerous, especially when you consider the dose that a child gets into. Where we saw a large bump in exposures to this was during 2020, children and teens presented to the emergency department kind of all across the US and across Canada in various states of intoxication after taking Benadryl after it was promoted on social media. Again, we kind of talked about in the earlier section on risks that children also begin to identify and self-categorize. So maybe as a person who has allergies. So if they get a runny nose or their animal has a particularly dandery day, right? They might try to self-medicate with these antihistamines that are common in the cold to treat the symptoms that they're experiencing. The last category we'll kind of touch on briefly are antidepressants. Again, just like our antihistamines, there are many different medications in this class. So these can be things like tricyclic antidepressants, things like Elavil, or SSRIs, serotonin reuptake inhibitors, things like fluoxetine or Paxil, or that may be in the home. And toxicity is going to look different depending on which medication a child has gotten into. So, for example, some things that might warn us that a child has gotten into potentially one of these medications is a change in their mental status. So, how they're processing information or able to communicate with us. Maybe they're sedated, or in the opposite direction, maybe they're a little bit agitated. They're a little more combative than normal. These might be warning signs that a child has gotten into a medication like this. On top of this, there can be things, problems with muscle stiffness, upset stomach, sweating. It's kind of a mixed bag, right? So if your child is acting abnormal, this is again one of those times where we 100% recommend calling the poison center. One category I do want to point out is our tricyclic antidepressants. Um, these medications can do really significant harm to children, even with just one pill. They can cause really potentially dangerous problems with heart rhythm and blood pressure drops. So those particular medications, even within this class, are ones that we should be a little bit concerned about and make sure that we're storing safely. In the same vein, kind of when talking about our antidepressants, I feel like it's important to just touch upon the fact that suicide rates among children, even 10 to 14, has been steadily rising. And the number of suicides in this age group has actually tripled from 2007 to 2017, according to the Centers for Disease Control and Prevention. Uh, Unfortunately, kind of where we are these days, it's actually the second leading cause of death in this age group. And so at the bottom of the screen, I've put just a link to the Department of Public Health subdivision on behavioral health in the state of Georgia to provide more resources if you're curious as a parent about what to watch for in terms of warning signs, or where you can get more information on that particular kind of subcontext of children getting into medications. So how can we minimize these risks? In previous presentations in our previous age groups, we've talked about basic home management. But with this age group, we saw that the exposures are really all, potentially medication related. And whenever a child of any age, or even an adult, potentially gets into a medication that is not theirs, or not for a health condition that they have and at their prescribed dose, we recommend that you include the Poison Center, and we can help you safely determine whether or not that can be managed at home, or whether that patient should be seen at a healthcare facility. But what I am going to touch on is how we can minimize risk that happens at all. So, first is talk to your child or your teen. You can establish family rules surrounding medication use. Things like, what are they allowed to use without supervision, and what should they not use without supervision? Who is that appropriate supervision, right? We want to create a learning environment in our homes that encourages discussion about responsible medication use and responsible chemical use, right, for chores or cleaning, because obviously what children, even though the top three exposures are medication related, they still can get into our cleaning products or our household products if they're not properly stored. You also want to talk to your children about who is a good source of information. So we want to teach children to turn to healthcare professionals if they have questions or concerns that parents can't directly answer. We want to teach them to remember that more does not necessarily mean better. So, combating that belief often held in children that more medication is going to equal more headache control, or, more of the effect that they want when they're attempting to use medication appropriately. And then remember, kind of just as I briefly touched on, that as unpleasant as it is, young children can and do try to harm themselves. So remember that the Georgia Department of Behavioral Health, as well as the NIH, has their National Institute of Mental Health. They're both great resources online for more on that subject. And secondly, we can act preventatively and be prepared. So we want to, like I've said a couple of times, make sure that we have medication, prescription and non-prescription, stored in a cabinet with a safety latch and ensure that you, as the adult or the parent or the caregiver, have that key and know that it's in a safe location at all times. You also always want to keep medications in their original containers, throw away any old medications or expired medications, and throw away other potential poisons. So perhaps chemicals or household products that are no longer in use. You want to check your garage, basement, any other storage areas for cleaning and work supplies that you don't use, and any places that your children might be. On top of that, be aware of what medications are in your home. Or if your children spend a lot of time at a relative or a friend's house, make sure you're aware what's there. Because in the unfortunate circumstance that something does happen, knowing what was in the home can be important information to provide to a healthcare provider when we are looking to figure out what is the best way to make sure that your child is treated safely and appropriately. If your child or kind of older teen, right, in that older 14-year-old age does manage their own medications, make sure they know and follow those family rules that we discussed just previously. And if possible, try to supervise them to make sure that they're taking the proper doses. And the last thing would be, learn CPR. Unfortunately, with this age group and kind of as we move into the teens, in our next section, we hope that there is never an emergency. But if there is, the best thing that you can do is be prepared. So learning CPR and the age appropriate CPR is going to be very important, just in case an emergency does occur. As always, we want you to know our number here at the Georgia Poison Center. Like I said, if anyone, regardless of the age, uses or takes a medication or a product that is not meant for ingestion or a medication that isn't theirs, you can always call us. With this age, there are a couple other recommendations that we can have. So to keep the Poison Center number by the phone, as well as your child's doctor or nearby relatives, just in case you have a child who's kind of home on their own. That way, they have access to those phone numbers near the telephone or in their cell phone if they need them. Thank you so much for joining us today for this kind of installment of our poison prevention program. I hope that you walk away with something that you learned, and we will open up the chat for questions just in case anyone has any comments or questions they have. All right. Currently, there are no questions or comments. So thank you so much for your time. Thank you so much for participating in this with us. Join us next month where we will close out this series with our next age group, which will be our teenagers, 15 to 18 years old. Again, if you're interested in information on younger age groups, those are all on our Facebook. They've been recorded so that you can watch them. I hope that everyone has a wonderful day. Thanks.